Ever wondered what those tiny growths inside your nose or sinuses are called? They're known as nasal polyps, mysterious formations that often pop up on both sides of the nose. Now imagine the sinuses as hollow areas in the bones of the face. It's within these spaces that nasal polyps find their home. There's a curious link between nasal polyps and a condition known as chronic sinusitis. This condition can leave one with a stuffy nose, a discomforting pain in the face, and a nose that seems to be on an endless mission of discharging mucus. The puzzling part, even the most seasoned doctors haven't quite figured out why some people get nasal polyps. Here's a bit of good news. Small polyps often go unnoticed, causing no symptoms at all. However, larger polyps or having more than one polyp can lead to unpleasant experiences. One might feel stuffiness or a blocked sensation in the nose, feelings of pressure or fullness in the face, or even have trouble smelling. To determine if someone has nasal polyps, a doctor or nurse will conduct an exam, peering into the nose with a special tool equipped with a light. They might also recommend a CT scan, an imaging test that captures a detailed picture of the inside of the nose and sinuses. So, what can be done about nasal polyps? The usual course of treatment involves medicines known as steroids, available in pills or as a nose spray. Don't confuse these with the steroids some athletes take illegally. Steroids for nasal polyps help shrink them, making it easier for one to breathe. Steroid pills should only be used for short periods, no more than a few weeks a year, due to potential side effects. If medicines don't manage to shrink your polyps, a doctor might suggest surgery. However, in most cases, polyps tend to return after surgery if no further action is taken. So, even after surgery, the use of steroids, usually in the form of nose sprays or drops, continues. The doses are much lower and can be safely used for years. Lastly, for those wondering if there's anything they can do on their own to feel better, the answer is yes. Some people experience relief by rinsing their nose and sinuses with salt water a few times a day. In conclusion, nasal polyps may be small, but they can have a significant impact on quality of life. Understanding them is the first step in managing and treating them effectively.